Yes, now we are progressing towards the plasma proteins and now after albumin we'll discuss the globulins. Globulins are separated by half saturated solution, and I told you what is half saturated solution. That is, you prepare suppose that 10 ml of full saturated ammonium sulfate solution. Out of these you take 5 ml and mix 5 ml with your test solution which is provided in the laboratory. So this will make up a half saturated solution and the proteins are globulins will be separated. Molecular weight of the globulin is from 90,000 to 1300,000 Daltons. By electrophoresis, globulin can be separated into different types. By fraction here, we mean the types alpha 1 globulins, alpha 2 globulins, beta globulins, gamma globulins. Now, where the globulins are synthesized. Alpha and beta globulins are synthesized in the liver, and therefore we have seen in the last slide that if the liver is damaged, then the proteins are decreased. Gamma globulins are synthesized by the plasma cells, beta cells of lymphoid tissue, reticuloendothelial system. Nature of different fractions of globulin. Alpha globulins. These are glycoproteins. Remember this. And are further classified into alpha 1 and alpha 2 depending on their electrophoretic mobility. That is how they move on the electrophoresis. What is electrophoresis? I'll explain you in the practical class also. But you just see it is a glass slab. On the glass slab, a gel is solidified. And then the sample is inserted with the help of a capillary tube. And it is in the apparatus, it is inserted in the upright position. ऊपर से नीचे सीधा सीधा खड़ा कर देते हैं. इलेक्ट्रिक करंट फ्लो होता है और जैसे जैसे अकॉर्डिंग टू द मॉलिकुलर वेट एंड द चार्जेस प्रोटीन्स के बैंड्स आते जाते हैं. फिर हम उसे डाई करते हैं और डाई करने के बाद यू कैन easily सी द बैंड्स, वेरी ब्यूटिफुल बैंड्स यू कैन सी ऑफ डिफरेंट टाइप्स ऑफ प्रोटीन्स. So the alpha 1 globulins are of further 4 types. Alpha 1 acid glycoprotein, Orosumucoid, fetoglobulin, alpha 1 fetoglobulin, fetoproteins भी इसको कहते हैं, alpha 1 globulin inhibitors, alpha 1 antitrypsin. Some of the alpha 1 globulins are of clinical importance. This classification is on the base of their amino acid content, on the charge groups, and according to the movement on the electrophoresis. Alpha 1 globulins, alpha 1 glycoprotein or Orosumucoid. Concentration in normal plasma is 0.6 to 1.4 grams per liter and average it is 0.9 grams per liter. Its carbohydrate content glycoprotein है, ठीक है? Carbohydrate and protein are combined together, so the carbohydrate content is 47%, and it is considered to be a reliable indicator of acute inflammation. It rises several folds in response to inflammation. Whenever there is inflammation, this protein, that is alpha 1 acid glycoprotein Orosumucoid, will be raised. Function of Orosumucoid, very important function. It binds to the hormone progesterone, female sex hormone, and facilitate its transport. It transports carbohydrate constituent to a site of tissue repair following injury. Whenever there is an injury, tissue is damaged, and carbohydrate, it transports carbohydrate to that part for repair purpose. Clinical importance of alpha-1 acid glycoprotein. It increases acute and chronic inflammatory disease. Just now I have told you whenever there is an inflammation, then the Orosumucoid will be raised. In the cirrhosis of liver, it is raised. Inflammation is there in many malignant conditions. In malignancy, there is also inflammation, and therefore the alpha-1 acid glycoprotein level is high. Decreased levels are seen in generalized hypoproteinaemic condition, that is when protein is low. Hepatic diseases, because they are not synthesized, cachexia, weakness due to severe illness, malnutrition, that is when the diet is not provided with diet is not balanced and it is not provided by a proper protein content. In nephrotic syndrome, obviously in the nephrotic syndrome the kidneys are damaged and the proteins they are excreted in urine. Alpha-1 fetoglobulin, alpha-1 fetoprotein. It is present in high concentration in fetal blood during mid-pregnancy. Whereas the normal adult blood contains a very small amount, 1 microgram per 100 ml. What is the clinical importance? It is a very important clinical importance, and it is a very good tumor marker in hepatocellular carcinoma. जब भी किसी को लिवर का कैंसर होता है तो अल्फा फीटोप्रोटीन को डिटेक्ट करते हैं, इसे क्वांटिफाई करते हैं, इसकी क्वांटिटी देखते हैं. Teratoblastomas, that is a neoplasm containing embryonic tissue, that is इसको हम threatened abortion भी कहते हैं. ठीक है, कि जब threatened abortion होता है ड्यू टू मेडिसिन या कुछ, तो जो एम्ब्रॉयनिक टिश्यू होता है उसमें भी, उस कंडीशन में भी अल्फा-1 फीटोप्रोटीन, क्योंकि फीटल है ना यार, मिड प्रेगनेंसी तो ये वैसे ही रेज हुआ है, तो जब भी थ्रेटेंड एबॉर्शन होगा तो न्यूप्लाज्म जो है, न्यूप्लाज्म कंटेनिंग एम्ब्रॉयनिक टिश्यू, तो उस वक्त जो है ना अल्फा फीटोप्रोटीन रेज्ड होगा. Alpha-1 globulin inhibitors. Some of the alpha-1 globulin inhibitors, they act as inhibitor of coagulation. Right? Globulin inhibitors, यार inhibitors का word लगा हुआ है ना, कुछ ना कुछ तो inhibit कर रहा होगा. So they act as inhibitors of coagulation, and some of them they inhibit some digestive enzymes like trypsin and chymotrypsin. So first function is that it acts as an inhibitor of coagulation, and second function is that it inhibits some of the digestive enzymes like trypsin and chymotrypsin. Alpha-1 antitrypsin, very important. It is antiproteinase synthesized by the liver. Antiproteinase, that is proteinase is that enzyme which break the protein, and antiproteinase, it means that it stops the breakdown of the protein. It is synthesized by liver. Molecular weight is 45,000 to 54,000. Normal value is 2 to 4 grams per liter, and approximately 290 milligrams per ml. It is polymorphic, that is having many subunits, and the multiple forms can be separated by electrophoresis. It is a protease inhibitor, just like I told you, that it inhibits the function of protease. It stops the or blocks the function of protease. What is protease? Protein hydrolyzing enzyme. And which protease it inhibits? It inhibits trypsin, it inhibits elastase, and some other proteases by forming complex with them. So how it inhibits trypsin? How it inhibits elastase? It forms complex with them, and in this way it blocks the proteolizing action of trypsin, proteolizing action of elastase. Antitrypsin activity. Several phenotypes of alpha-1 antitrypsin have been identified. What do you mean by antitrypsin? That is which stops the action of trypsin or which work against trypsin. The most common type is MM, associated with normal antitrypsin activity. Now, I have used the word phenotype. What is phenotype? Phenotype is defined as physical and physiological character of an organism from both genetics and environment. You see, people of different countries, they have the same appearance, they have the same characteristics. For example, the people which are present in the African countries, they have the same appearance, physical and more or less the psychological character or characteristics of these people is also same. So phenotype it एक्चुअली क्या उसको कहते हैं कि एक इलाके को आइडेंटिफाई करती है कि ये इस कंट्री के लोग हैं. अगर कोई आपसे कहे कोई अफ्रीकन आ रहा है आपसे मिलने, तो यू कैन जस्ट इमेजिन उसकी फिजिक क्या होगी, उसकी कैरेक्टरिस्टिक्स क्या होंगे. ठीक है, because the genetics also and the environment it affects the phenotype. For example, a phenotype is a group of organisms which are all affected in the same way by nature, right? So the which are affected in the same way by nature. गर्मी है तो सबको, बहुत ज़्यादा गर्म कंट्रीज में रहते हैं उन सबको गर्मी लगेगी, उनकी अपीयरेंस एक तरह की होगी. सो विच आर ऑल अफेक्टेड इन द सेम वे बाय नेचर. फॉर एग्जाम्पल फिशेस हैं, फिशेस सारी के सारी पानी में खुश रहेंगी, अगर आप उनको सूखे में निकालोगे तो वो मर जाएंगी. सो दिस इज द phenotype ऑफ द ऑर्गेनिज्म, राइट. आप इंसानों को पानी में डाल दो, वो थोड़ी देर तो खुश होंगे और उसके बाद फिर उनकी बॉडी जो है वो उसको रेजिस्ट करेगी एनवायरनमेंट को. सो द phenotype it determines the habits, the genetics and the characteristics of an organism which is living in a particular environment. Adult with phenotype. phenotype यानी फॉर्म्स ऑफ जीन होते हैं, समझ लो आप, जो कि एक पॉपुलेशन को दूसरे पॉपुलेशन से अलग कर रहे होते हैं. एशियंस की हैबिट्स अलग होती है और अफ्रीकन्स की हैबिट्स अलग होती हैं, अमेरिकन्स अलग होते हैं. These are present, this difference is due to the different phenotypes present. Adults with phenotype ZZ alpha-1 antitrypsin suffer from deficiency, severe deficiency, suffer from lungs disease होती है, emphysema of lungs होता है. What is an emphysema of lungs? That is the lungs alveoli, they are damaged and there is a shortage of blood. Cirrhosis of liver होता है. So basically those adults which are deficient in ZZ alpha-1 antitrypsin, they suffer from lung disease, emphysema of lungs and the cirrhosis of liver. It is considered as one of the acute phase reactant. Acute phase, ये third function है globulins का, ठीक है. So acute phase proteins are defined as those proteins whose serum concentration increase or decrease by at least 25% during inflammatory status. It is considered of the acute phase reactant. That is, globulins, they respond to the inflammatory diseases and their concentration is increased or decreased in inflammatory condition. Such proteins either positively or negative, such proteins are termed either positive or negative acute phase reactant. अगर उनकी क्वांटिटी इंक्रीज हो रही है तो दे विल बी पॉजिटिव एक्यूट फेज रिएक्टेंट और अगर डिक्रीज हो रही है सो देर विल बी अ नेगेटिव एक्यूट फेज रिएक्टेंट. सो थर्ड फंक्शन इनका क्या है कि दे आर द acute phase reactant. They considered as an acute phase reactant, and during inflammation their quantity can be decreased or increased. If it is increased, then they are known as a positive reactant, and if it is decreased, then it is said to be negative acute phase reactant. Since considered as acute phase reactant, concentration is increased in trauma, burns, infarction, malignancy, liver disease, chronic hepatocellular disease, and biliary obstruction, in pregnancy and also during contraceptive medication. In all other conditions, all these conditions more or less, they are associated with inflammation. Neonates have serum concentration below adult value but gradually increase with age. Decrease in alpha-1 antitrypsin is seen in प्रोटीन लूजिंग डिसऑर्डर्स. तमाम प्रोटीन के जितने भी जिसमें प्रोटीन लूज हो रहा है, नेफ्रोटिक सिंड्रोम, दैट इज किडनी डिजीजेस, hypoproteinemia, again the protein losing disorders, emphysema of lungs. I have told you in the previous slide what is emphysema of lungs. Alveoli are damaged and there is shortness of breath. Obviously, whenever the alveoli are damaged, then the oxygen will not be properly transported and there will be a shortage of breath. Juvenile cirrhosis of liver or juvenile liver cirrhosis, that is in childhood, in young children, when the liver it is suffer from cirrhosis, that is a liver cirrhosis in children, newborns. So in all these conditions, the decrease in the serum alpha-1 antitrypsin is seen.